In today's video, we're going to unpack some of the health issues and discussions that Trump and RFK Jr. had during the cabinet meeting of October 9th. Let's get started.
President, I'm glad you're getting bipartisan accolades on the Mideast Peace Agreement. You should also get bipartisan accolades on the MFN agreement. It is an historic agreement that's going to benefit every hardworking American. It's going to lower the price of drugs for every American.
The Most Favored Nation Agreement, or MFN, was supposed to make U.S. drugs more affordable and as low as the cheapest price paid anywhere in the world. So imagine telling Big Pharma, hey, if Germany gets it for $50, well, why are we paying $150? The idea was simple. Tie what Medicare pays to the prices in 22 wealthy countries. It targeted high-cost drugs given in hospitals and cancer clinics, the kind that can bankrupt a patient before the disease does. Well, full stop here. RFK Jr. mentioning the Most Favored Nation rule in 2025 isn't itself strange, given that Trump signed the executive order in September 2020. Medicare officials were ready to roll it out. But, well, until the court said, not so fast, drug companies and hospitals sued, arguing the rule skipped legal procedures and could limit access to those medications. In December 2020, a federal judge blocked it. The policy never took off. So him mentioning in the cabinet meeting in 2025 is very strange.
By the time this administration is over, we will have 95% of the drugs in this country will be the lowest price in the world. It immediately begins to affect Medicaid, Medicare, Social Security, the other government programs.
RFK Jr. is trying to tie the lower drug prices with an executive order that was blocked in 2020. Kind of strange that he brings this up in this current cabinet meeting. Drug prices will go down in January 2026, but it doesn't have anything to do with the current administration. Instead, it has to do with the Inflation Reduction Act that was passed in 2022. Under the Biden administration. We'll talk more about the Inflation Reduction Act and drug prices a little later on. Let's continue to listen to RFK Jr. talk.
I remember when I went through the confirmation process, and the principal preoccupation of the Democrats during that process was whether I would continue the IRA negotiations on drugs.
So he's essentially complaining that the Democrats were pushing to make sure that the Inflation Reduction Act, which has a program to reduce drug prices, it gave Medicare the authority to negotiate prices. Now, before this act, Medicare did not have any power to negotiate prices. Isn't that crazy? And they did negotiate prices for 10 drugs. The negotiated price drugs will go in effect in January 2026. These 10 drugs together cost over $50 billion in 2022, about 1/5 of everything Medicare spent on prescriptions. These 10 drugs are important because they treat common long-term health problems many adults face, like heart disease, diabetes, arthritis, and cancer. Of course, when we have a confirmation hearing that's going to affect these prices of these drugs, we're going to make sure that this kind of program doesn't go away. They also pick these 10 drugs because they're expensive brand name drugs that don't yet have cheaper generic versions. And I think that makes complete sense. So it's understandable that the Democratic Party wanted to make sure the part about Medicare being able to negotiate drug prices.
The Democrats negotiated 10 drugs. I'm supposed to negotiate every year 15. The 10 that they negotiated, they claimed to get a 22% reduction, but it was a lie. It was 22% under the list price, which was actually higher than the price we were getting. So Medicaid, Medicare ended up paying more for those drugs than they were paying beforehand. They only got a benefit on one drug. One was tied. 8 of them were lower. So they should be applauding what we're doing now. We're doing something that every administration, Democrat and Republican, has been saying that it was going to do for decades, and you got it done because you understood the power of the tariffs. That we had leverage over these companies.
All right, let's just unpack that for a second. What is he really talking about? RFK Jr. says Democrats only got a 22% fake discount on 10 drugs, and that Medicare actually paid more. Well, that sounds explosive, but here's what the data actually show, because we look at data first before we make a statement. The Inflation Reduction Act gave Medicare new power to negotiate prices directly for the first time in history. Yay! In August 2023, CMS picked 10 drugs. Think big names like Eliquis and Juvia and Stelara. These are some of the Medicare's top spending drugs, costing taxpayers nearly $50 billion a year. Now, the 22% discount claim, that number refers to the average reduction from the drug's list price, not from what Medicare already paid after rebates. But that doesn't mean Medicare paid more. It means CMS is still in the early phase of negotiations. The new prices don't take effect until January 2026. So no, there's no evidence Medicare paid more because the negotiated prices haven't even kicked in yet. In fact, the Congressional Budget Office estimates these negotiations will save $98.5 billion over the next 10 years. So while RFK Jr. is right that list prices can be misleading, the claim that Medicare paid more or that the 22% cut was a lie, that's not supported by any current real data. In short, 10 drugs negotiated so far. Discounts are real, but based on list prices. No higher Medicare spending. Prices take effect in 2026. And projected savings close to $100 billion. That's a win for taxpayers, even if the politics make it sound otherwise. I hope this cleared up what he just said.
And you did it in a way which you asked us to do, to negotiate in a way that was not going to stifle innovation, that was going to make sure that those companies could bring their production home, and they are doing that. And it was a profound success. It will affect every American for 100 years. And you should be getting bipartisan accolades on that.
Does anyone know what he's talking about in terms of the bipartisan accolades that Trump should be receiving? Based on the couple of minutes that we've listened to him, what bipartisan accolades is he referring to? He can't be referring to the drug price going down because that's been already negotiated and will be in effect in January 2026. And that was a different program altogether. It was not part of something that Trump did in his previous term. If you have any thought, please put that in the comment section. I think people want to know. So it's just surprising that in the couple of minutes we've listened to him, he seems to have these run-on thoughts. He should be available to listen to the experts rather than go by his own opinions and speculations. That's where we run into problems. I will be fact-checking the other parts of the cabinet meeting that was held on October 9, 2025, where he talks about vaccines, autism, and Tylenol. So watch out for that video. That'll be coming soon. Thanks for watching and stay tuned for more of this kind of video. Bye-bye.